Open access, getting patients seen the same day or next day. You may ask, what's the difference between open access and offering walk-in appointments? Walk-ins are simply unscheduled visits where individuals physically enter the office without a prior appointment. Patients are attended to based on the order of their arrival or the severity of their medical or behavioral health needs, while open access allows you to schedule that intake and those diagnostic evaluations for behavioral health services on the same day or maybe the next day, depending upon the time that the individual calls. The initial contact or referral to the time of the intake is done within 24 hours. And from that intake to the assessment is within the next 24 hours. And from that assessment to the first full clinical visit is within 48 hours. Telehealth can also be used to handle all open access tasks. When thinking about patient wait times, open access actually decreases and stabilizes patient wait times. The average patient wait time can be up to 27 minutes or higher based on volume, where walk-ins create challenges with staff and trying to make sure that we have the capacity to meet individuals' needs, which can increase those wait times, where open access allows you to manage staff capacity and wait times by scheduling those appointments throughout the day. With a walk-in model, staff overtime can be uncontrolled. Unfortunately, if someone walks in the last minute, now you have staff that are going into overtime because you need to meet those individuals' needs. Where with an open access model, you can ensure that you're only scheduling during times that you have staff available, which decreases the likelihood of having staff overtime or uncontrolled overtime. There are numerous benefits to your practice of implementing an open access model. Reduction in patient no-shows, reduced wait times for appointments, reduction in urgent care and hospital visits, improved patient outcomes, a great marketing opportunity to let patients know that you can get them seen same day or next day. And also, it reduces your staff burnout. These are all really important things to help your practice grow. The CMAG team has helped over 30 organizations implement the open access model. The process that we have found that works is initially you'll complete an organizational assessment. We will review policies and practices and processes within your organization. We'll develop a strategic plan of how you're going to implement the open access model. We develop key performance indicators so that we know how successful we are. We have a soft launch to make sure that everything is working smoothly. And then we have the full launch and create marketing campaigns to let your colleagues know, let your referral sources know, and let individuals in the community know that they can be seen same day or next day. Are you wondering how prepared is your organization to implement the open access model? Well, you can take the Open Access Readiness Assessment. You can scan the QR code here to take the assessment, or you can visit cmagandassociates.com and there's a link to the assessment right on our website. Once you complete that assessment, a member of the CMAG team will reach out to you and we can sit and talk about what it is that you may need to get open access as a part of your organization. To learn more about the open access model, contact the CMAG team for a free consultation. We can be reached at 410-517-CMAG. That's 410-517-2624. Or send us an email at info@cmagandassociates.com. We look forward to speaking with you.